Welcome to Phase 3 of the InBrace fitting appointment. In this video, we discuss how to bond brackets using InBrace Indirect Bonding trays, or IDB trays. During the fitting appointment, you can bond either one arch or both arches. The provider can also choose which arch to bond first. In this video, we begin with the lower arch. When bonding to the upper or lower arch, begin with the anterior tray segment. The three IDB tray segments are not designed to fit in the mouth all at once, so you'll remove the anterior tray before proceeding to the posterior trays. The bonding process begins by drying the 6 lower anterior teeth with a tooth dryer in preparation for applying primer. Apply a very thin layer of Assure Plus onto each etched tooth. Then air thin the primer on each tooth 2 to 3 seconds using a tooth dryer, which offers a controlled flow of warm dry air that evaporates the alcohol solvent. Then light cure the primer for 5 seconds per tooth. Keep in mind from this point forward, moisture will contaminate the cured primer. Now open the white storage case and select the lower anterior tray segment with pre-pasted brackets. Place the patient in an upright position. When bonding to the lower arch, move your chair around so you're facing the patient. Hold the lower anterior tray segment using your thumbs and index fingers. Your thumb is placed on the labial side of the tray while your index fingers run along the lingual side of the tray. Place the IDB tray onto the anterior teeth in a rolling motion, starting from the lingual in an incisal labial motion. Apply light lingual and occlusal pressure on the anterior tray with your fingers to ensure a tight fit. Then light cure each bracket in the tray for 5 seconds per tooth. If your curing light measures below 2,000 milliwatts per centimeter squared, then add more time to each 5-second light cure cycle to prevent debonds. Then, light cure each bracket a second time for 5 seconds per tooth. Now remove the tray by gently rolling the tray in an incisal lingual gingival motion while pushing the canines towards the midline. Now you're ready to bond the lower posterior trays. Select the right or left side of the arch and then thoroughly dry all teeth to be bonded using a tooth dryer. Apply a very small amount of Assure Plus, air thin the primer using the tooth dryer, and then light cure each tooth for 5 seconds. Select the lower posterior tray from the white storage case. Move your chair to face the patient during tray delivery with the patient seated slightly upright. Posterior IDB trays feature a handle that's designed to help you deliver the trays to the distal region using lingual Weingart pliers. When you seat posterior trays, remember to start from the lingual and roll them over the dentition in a lingual occlusal buccal motion. This prevents the adhesive in the tray wells from smearing across the tooth surface during tray delivery, which can lead to unwanted debonds. Once seated, apply light occlusal pressure using your finger and light lingual pressure on the interproximal areas of the IDB tray using the engager or a band pusher. This ensures a good fit between the tray and the teeth. Then light cure for 5 seconds per bracket. Then light cure each bracket a second time for 5 seconds. To remove the posterior trays, first lift the tray from the buccal side and roll the tray in an occlusal lingual gingival motion. Now repeat the process for the other posterior tray. Once the trays are removed, inspect for adhesive voids. If a void is observed, apply a small amount of flowable adhesive to the tip of an explorer and fill the void. Then light cure it for 5 seconds. Now light cure each bracket on the arch a third and final time for 5 seconds. The indirect bonding process for the upper arch is much like the lower arch. It begins by drying the upper anterior teeth with a tooth dryer in preparation for applying Assure Plus. After the primer is air thinned and light cured, the upper anterior tray segment is delivered. When bonding to the upper arch, recline the patient in the chair. You typically work from a 10 o'clock to a 2 o'clock position when bonding to the upper arch. When delivering the upper anterior tray, move directly behind the patient at a 12 o'clock position and hold the tray with your 2 thumbs on the labial side of the tray and your index fingers running along the lingual side of the tray. Then place the tray over the upper anterior teeth, starting from the lingual in an incisal labial motion, just like you did on the lower arch. Once seated, apply light lingual and occlusal pressure using your finger to ensure a good fit. Light cure each bracket for 5 seconds. Then light cure each bracket a second time for 5 seconds. Now remove the tray by gently rolling the tray in an incisal lingual gingival motion while pushing the canines towards the midline. Now, select the left or right side of the upper arch and thoroughly dry the teeth using a tooth dryer. Apply primer, air thin, and light cure. Then, using lingual Weingart pliers, deliver the posterior tray and seat the tray by rolling it in a lingual occlusal buckle motion. Use light occlusal finger pressure to make sure the tray is fully seated. Then use light lingual pressure on the interproximal areas of the IDB tray using the engager or a band pusher. Then light cure each bracket for 5 seconds. Repeat the light cure a second time for 5 seconds per bracket. Leave the first posterior tray in place unless the arch is narrow and it gets in the way. Thoroughly dry the remaining posterior teeth, apply primer, air thin, and light cure for 5 seconds. Now seat the second posterior tray and light cure 2 times for 5 seconds. Then remove both trays. Once the trays are removed, inspect for adhesive voids. If a void is observed, apply a small amount of flowable adhesive to the tip of an explorer and fill the void. Then light cure it for 5 seconds. Now light cure each bracket on the arch a third and final time for 5 seconds.
This completes the third phase of the fitting appointment. The fourth and final phase of the fitting appointment are the post-bonding procedures.